Hello, everyone. Thank you for joining us today. My name is Emmanuel Boardman. I work with the LGDA. I'm joined today by Dr. Bryan Sisk from the Washington University School of Medicine in St. Louis, and Dr. Anna Kerr from the Heritage College of Osteopathic Medicine at the University of Ohio. And they are here today to talk to us about the Vascular Anomalies Communication Project and provide us with some information. And I will turn things over to them as they kick things off.
Thank you so much. And thank you everyone for joining us. Bryan and I are here today to tell you about this exciting project that we have. We want to tell you a little about the goals for our research and also just what it means to participate and answer any questions that you might have about the two research opportunities that we have coming up. So here are our amazing pictures. As Emmanuel gave a great introduction, the two of us are researchers who are interested in vascular anomalies and have been affected by this in many ways. And so the project that we're looking at specifically relates to communication and care experiences of patients and families that are affected by vascular anomalies. And what this means is that we are doing two things. We are doing an interview process and an online survey to try to hear more about your experiences, examples of great communication that you've had, of great access to care, and then some of the challenges that you've had so that we can help reduce some of those barriers. So the specific objectives that we are trying to learn, and these are the things that we'll ask you in the interview and in the survey, is how do families get a diagnosis? What's the journey, the route? We know sometimes it's a very long journey to get to a diagnosis. And so what are those key components that help families get to the diagnosis that they need so they can get the care that they need? Then what types of care do families need? What are the things that you need day to day? What are the routine care that you need? And then also, as you can see with the last one, what are the primary care and emergency care needs that you might need when you're at home taking care of yourself or taking care of your child? We want to know how families find doctors who know about vascular anomalies and what the interactions are like with doctors who don't know a lot about vascular anomalies, and how that communication with doctors go. What are examples of good communication and what are examples of bad communication? So we're announcing the study today to share with you that hopefully you're all eligible to participate in one arm of the study or another. The first eligible group are caregivers of children with vascular anomalies. So if you are the parent of a child who is under the age of 18, we invite you to participate in the interview and in the upcoming survey to tell us about your experiences as a caregiver. If you are an adult patient and you are over 18, we invite you to also participate. We, for interviews, are recruiting patients age 18 to 39. That's the general cap for kind of the young adult group. And so we encourage you to reach out if you fall within one of these categories to participate in either one of the research opportunities. So I'm going to share a little bit about what happens during the interviews, and then I'll toss it over to Bryan to tell you a little bit about the survey. And then we're going to share information for how you can sign up today if you're interested to participate. So what happens during the interviews? An interview is kind of a fancy way of just saying a really in-depth phone conversation. So we will reach out to you by phone. We also can do it via Zoom, whatever you feel the most comfortable with. And we'll ask you a lot of open-ended questions. These are going to be things like, tell us about a time when, or what was something that was most challenging, or what's an example of a time when things went well. And we are relying on you as the expert of your experiences, of your condition, of your child's condition. The interviews take about 45 minutes to an hour, just depending on how long the conversation goes. But really, this is a chance for you to share anything that you think we should know about your experiences getting care and communicating with clinicians. And we are opening this up to residents of the United States, and anyone who participates is eligible for a $40 Amazon gift card. And so this is the interview portion. If you are interested in participating, we will share a link at the end and a QR code where you can tell us, hey, I think I'm eligible, I'm interested in participating, and then one of us will reach out to you to get you registered for the study. The other opportunity is the survey, and I will let Bryan tell you a little more about the survey.
Perfect, and I just put also in the chat, let me try it again. I'm putting in the chat now the link also, so you can have it if you're interested, that you can mark in there. So the second part of the survey, or the second part of the study, is a survey. And to step back, the big picture is that Anna and I have both know firsthand and from experience with patients that families experience a lot of challenges with care and communication. But if we want to try to fix them, we really need to be able to, in a very detailed way, characterize and describe them, and then as best as we can, quantify them. That's how we understand really well what's going on, but that's also how we convince funding agencies that we need support to try to build tools to help families in the future. And so this is really the ground level work that we're hoping to build on, for the next 5, 10, 15 years. The survey is going to be broader than the interview study. For the survey, you can complete it on a phone or a tablet. It's fully electronic. It should take only about 15 or 20 minutes. Anything that you tell us, whatever's true to you, is what we want to learn. And we're offering a $25 Amazon gift card. The gift card we can only give for tax purposes to people that are living in the United States, but the survey is, people are eligible for the survey around the world. So the eligibility criteria for the survey would be, number one, if you are, again, the parent of a child with a vascular malformation or any adult patient. So unlike the interview survey where we're trying to focus on that 18 to 39-year-old range of patients, in this, it's really any patient with a complex lymphatic anomaly, a vascular anomaly through the that's 18 or older. Next slide. And what we'll do with the information is really 3 big things. One is we're going to make sure that we include you all and return the results back to you, because we want to not only learn from you, we also want to help you learn from each other and from others with these different types of disorders. And so we're going to share results with you through webinars. We'll also, if you participate, we'll send out updates when we have publications so you can see those. The other thing we want to do is, once we really identify what the biggest challenges are that are affecting families, we want to try to fix it. We want to come up with, whether it's tools or strategies or workflows that are going to make life and care better for our families here. And then the last thing, like we talked about, is to try to apply for bigger grants in the future that are going to give us more resources to really try to not only build tools, but expand them out so we can help people across the country, not just in a single center. Next slide. And really, that's the bulk of the information that we have. And I'm just going to go through a couple of frequently asked questions that we've had from folks to reiterate some points. And then we are happy to answer any questions that might come up through the Q&A or through the chat. So first, reiterating how many people will participate. This is part of a larger study. Through the LGDA, we're hoping to get at least 20 caregivers and 10 adults with vascular anomalies or with complex lymphatic anomalies. And we will include that in our bigger study that has about 30 caregivers and about 20 or so adults. And so we'll keep building up on those numbers so we can get a broader understanding of what people are experiencing. Second question, do caregivers and patients have to be related? No. So you can be a caregiver but not have your child participate, and you can be an adult patient and not have a caregiver. So no relation needed at all. Who's funding this project? This arm of the project is funded by the Orphan Disease Center at University of Pennsylvania. It's called the $1 Million Bike Ride Pilot Grant. The interviews will last usually about 45 to 60 minutes. It all depends on how much you have to tell us. And then the surveys will take, we say, about 15 to 20 minutes. Probably a lot of people will finish it closer to 10, but to be safe, budget 15 to 20 minutes. And if you don't live in the United States, you can certainly participate in the survey. We just cannot do the interview with people that are living outside the United States. And next slide, I think that might be it. So here's a QR code that you can pull up your camera on your phone, or you can go to the link that's in the chat. This will take you to an interest survey. So this is just a survey that says, I'm interested, let me put my contact information. It gives us permission to contact you and tell you more about the study. It doesn't require that you participate in the study. It's more if you want to learn more, if you think you want to be part of it, we'll then talk in more detail about it, and you can decide later if you're fully committed to wanting to be in it. The interview study is recruiting right now. The survey study, we are finalizing all the preparations. Probably in about a month, we'll be ready to launch that. And then if there are any older adults out there who say, well, I'll do the survey, but I'm also interested in the interview study. If you are 65 years or older, we also have a separate interview study called an oral history project. And you can also email us or fill out this survey link, and we'll reach out to you and talk to you about your eligibility for that as well. That's what I had. Anna, did you have anything to add?
No, I'd love to take some questions. Feel free to put something in the chat or unmute yourself if you'd like. As you're brainstorming those, a few things that have come up are that the survey and the interviews are completely anonymous or confidential. Anything you tell us, your name will not be associated. Bryan and I will know who you are because we'll have to schedule an interview time with you for the interview. But if it's the survey, it's 100% anonymous. If you get a gift card, when you give us your name and things for the gift card, it's separate from the survey. So we really want you to feel comfortable that the information that you share with us will be confidential. When it comes to publishing it or sharing it, what we do is kind of a process of bringing everybody's information together and summarizing what everybody said. And so we might pull out quotes or things, but I do get a question sometimes of, will this be anonymous? Is my name attached to this? And we really want to reassure you that we go to great lengths to make sure that you feel comfortable sharing whatever you want to share about your experiences. Can you think of any other frequently asked questions? Oh, one time I was asked if this includes giving any sort of samples. This isn't a study like a registry study where you might give a swab or any sort of a sample. This is a research study that we want to hear from your experiences. And so there's not any sort of kind of clinical or lab work that's associated with participating in this either.
Yeah, and I think the biggest questions that I've gotten from people over time are, number one, about the making sure it's anonymous. And in fact, if we were writing a paper and you had a really, really amazing quote that you gave us and we would love to use it, but it would just be too specific to you, we won't use it because that's one of our rules. We don't use anything that's identifiable. Yeah. The second thing we often hear from families is, are you just going to come in and get our information and leave? Or are you going to stick around and be part of our community? Our goal and our full intention is that we're going to be part of your community, part of the Vascular Anomalies community going forward. This is something that we're both committed to. Anna's personally committed to it. I am personally committed to it. My clinical practice is about 95% of the patients I see have vascular anomalies. And when you see families that are affected by these challenges, it motivates you to want to fix it. And so we are not going to swoop in, get data and leave. We really expect this is the first of a long series of projects that you're going to help us think of and plan so that we can make sure we're doing things that are actually helping you. That's really our goal. And then the third thing that often is brought up is, how are we going to know that this is making a difference? And that's where we'll make sure we let you know through webinars like this, through posts on LGDA, but also through publications. And if you participate, sending those publications to you when they come about. That has the benefit, number one, of making sure that we're actually putting our money where our mouth is and doing the work that we're promising. And number two, we can get you a copy of the paper that sometimes is hard to get when there's paywalls and things like that. I think that's the bulk of it. I'm really glad we're recording this too, because anybody that can't make it today can also see this. But we are both wide open for any questions, comments, anything at all. So please feel free. There are no barriers to emailing us. We'd love to tell you about the study. Even if you don't qualify for the study, we'd still love to tell you about it and think about what we might do in the future together.
Amazing. This was an incredibly informative session. Thank you both so much for your time. We will distribute this recording to our community, and I think people will reach out with more questions as they come up. Thank you both again. We really appreciate it, and have a wonderful weekend to everybody.
Thank you. Thank you for having us.
Bye-bye.
Bye.